Welcome back to Angel Winnie Nursing Tutorial. In this video, we are going to study about the mental health nursing in that mental health team. So, what is mental health team? Have you heard about the mental health team? So, we have heard about the health team. Okay, in the fundamental, you have heard about the health team. Or who all will be comes under that. So, doctors, nurses, laboratories, all those things will coming under the health team. Okay, same like that here it is a mental health team. So who all are will be coming under that. So what they will do that we are going to study in this mental health team. So mental health team means so what is coming in our mind, it's a multidisciplinary approach. Yes, kind of people or different kind of people will be there. So it refers the collaboration between the different kind of disciplines who provide the special service to the patient. Yes, they are giving the special service to the patient, so that we can call it say mental health team. Okay, so let's see who all are will be coming under the mental health team. So who all are will be coming under that? Doctor will be coming, or we can say the physician or the doctor. Doctor means who the mental health team. So we used to call it say psychiatrist. Yes, then psychiatric nurse will becomes, then pharmacist will becomes, then clinician will becomes, and then honorable counselor will becomes in that. Okay, so these all other members will be coming under the mental health team. Mental health team. So what is the definition of mental health team? So mental health team means it's a multidisciplinary approach, refers to collaboration between the members of different disciplines who provide specific service to the patient. So different kind of department people will be there. So they will work and they will be having the collaboration between, and they will provide the specific service to the patient. So that we used to call it as a mental health team definition. Okay, so let's see who all will be coming under that. Mental health team includes a psychiatrist, psychiatric nurse and clinical psychologist, then counselor and psychiatric social worker, occupational therapist, pharmacist and dietitian. So these all other members will be coming under the mental health team. Okay, let's see one by one. First one is a psychiatrist. So in that psychiatrist, what they will do? So they are the medical doctor with special training in psychiatry. So who can we call the psychiatrist? So they should have the what? The special training in the psychiatry. So we can call them as a psychiatrist. So that is their responsibility. Next one, it is accountable for the medical diagnosis and treatment of the patient. So what is that? They are maintaining all the accountants and diagnosis and giving treatment to the patient. So that is a function of the doctor, and these are the main important functions. Okay, so next is the other functions. Okay, other functions of this one psychiatrist is a admitting the patient in the acute care settings. Yes, once the patient, mental ill patient comes, so they will admit in the acute care. So that is a first primary care settings they will be giving the admission. So that is responsible by the psychiatrist, and prescribing and monitoring the psychopharmacologic agent. Yes. So there are the antipsychotic drugs. Okay, so they have the rights. Who have the rights? Only the psychiatrists have the rights to prescribing. Okay, to write prescribing and monitor the psychopharmacologic agent. So whether it is active or not, or how will be working, all the things have the responsible by the psychiatrist. So next one is administering ECT. Have you heard about that ECT? So ECT means is electroconvulsive therapy. Have you heard about the patient, those who are having the mental illness, so we will give the shock treatment. So that we used to call it is electroconvulsive therapy. Okay, so that we used to call it is ECT. So in the normal people, they will say that okay, they give the shock treatment to the patient, but the original name of this is the medical term we are using, ECT or electroconvulsive therapy. So who have the rights to give the ECT? Doctor will say that patient is not well or patient is need the shock treatment or the ECT. So doctor will administer the ECT. Okay. Then conducting individual and family therapy. So there is a therapy should be controlled by the this psychiatrist. So they will give the individual and family therapy. Then participating in interdisciplinary team meeting. There are the interdisciplinary team meeting will be there. The people who are in the healthcare team, the doctor will be the dean or the doctor will be the person or MD will be conducting the meeting. And the legal power to prescribe and to write the orders and function as a leader of the team. Yes, as I said here, so the psychiatrist is the leader of the team and he will be having the rights to prescribe and to write the orders. Okay, so what are the treatment has to give it to the patient, all the things will be done by the psychiatrist. So psychiatrist is the major and is a main role in the mental health team. So this one is a psychiatric nurse. So psychiatric nurse functions and role in mental health team. Okay, let's see. So here okay, next one is a psychiatric nurse. So we can see the what are the roles of the functions of the psychiatric nurse in mental health team. So first one is that the psychiatric nurse should be registered in nurse with a specialized training in the care and treatment of the psychiatric patient. So she should have the registered nursing. Okay, so registered, she should be registered nurse and should have the experience training in the care of psychiatric this one patient and the treatment. Okay, without that without the training how she can cope or how she can give the care to the patient, that is impossible. So they are giving the more importance is that they should have the training in the psychiatric patient, how to take care of the psychiatric patient. So the first one is the that is a role and function, and next one is that she may have the diploma, MSc, MPhil or PhD in psychiatry nursing. Okay, she may have the MPhil or MSc or PhD or diploma. The course has to be there. Okay, she should have, then only they are eligible or they can give the psychiatric care to the patient. So next one, she is accountable for the biopsychosocial nursing care to the patient. So what is biopsychosocial nursing care to the patient? So whatever happens, she know how to handle the patient. That's why we are saying that patient she should have the training in the psychiatric nursing. Okay, so then only how to take care of the psychiatric patient. Is it easy? Not. So when we are take care of the normal patient, that will be very easy. So they are conscious. Yes. So what we are saying you have to take the tablet at a correct time. Then they will obey. So what about the psychiatric patient? They won't obey all the things. So how to handle the psychiatric patient? The nurse should have the specific training. Okay. So then only they can handle these all the things. So these are the main functions, and here it is the other functions. Okay, other functions we can say here the patient has the nurse should have the administering and monitoring the medication. Yes. Who have the rights to prescribe? Doctors. Only the doctors have rights to prescribe the medication. Here they will administer means they will giving and monitoring the patient the status, all the things. Who will be monitoring? That is a nurse. Okay, next one is assisting in numerous and psychiatric and physical treatment. So they will be assessing in the numerous psychiatric and physical treatment. So all the assessment, all the care is given by the nurses. Okay, so next one, participating in the interdisciplinary team meeting. So she also will be the member of the interdisciplinary team meeting. So who is the leader? The psychiatrist will be the leader and teach the patient and family members about all the things. Yes, patient having the patient everyone is not having the mental illness. So say if they comes with the starting the mental ill problem, so they will give the teaching and education to their patient and their family members and take the responsibility for the patient records, act as a patient advocate. Okay, so what is advocate? So the nurse has to be as an advocate. You have studied in the first year the qualities of nurse. Okay, so she here will be maintaining the documents, records and reports. Okay, so as an advocate of the patient, she will be maintaining all the record which is there in the hospital, then interact with the patient with the significant others. So doctor will be giving all the things, so doctor won't be have the time to spend with the patient, right? It's more won't be have, so more time who will be spent with the time with the patient? The nurses. So she will be interact with the patient and significant others. So the nurse will be more interact with the patient, and she will be asking all things, she will be giving the care to the patient. So this is the functions of the psychiatric nurse in mental health team. Okay, so third one is the clinical psychologist. So here the clinical psychologist who is working in the mental health team, and they should have the master's degree in the psychology or the PhD in clinical psychology with specialized training in mental health settings. So she or he should have the master's in psychology or else the clinical or the PhD in the clinical psychology, and should have the specialized training in the mental health setting. So those people will be the clinical psychologist, and the clinical psychologist should have the accountable for the psychological assessment and testing and treatment. So when you are going to the hospital, okay, so mental hospital, there will be the clinical psychologist first. So they will be referred to the clinical psychologist. They will take the all the assessment and the testing and treatment. Okay, so they will give some of the papers to fill out all the things, and they will assess our mental status examination. All the things will be done by the clinical psychologist, and they are responsible for the psychological assessment and testing and the treatment. So next one, he will be offer a direct services such as individual and family and marital therapies. A kind of therapies will be given by the clinical psychologist. Why it is given by the clinical psychologist? Why can't doctor can give all the things? Okay, so doctors will be always, they will be busy, and they have the rights to prescribing and giving the treatment. So these people, these are the people, so we have seen psychiatric nurses and clinical psychologists, dietitian and counselor. They have respective their works. Okay, work schedule will be there, their job will be, sir. So according to that, they will giving the treatment, or they will give their services to the patient. So these are the functions of the clinical psychology. Fourth one is the an occupational therapist and activity therapist. Okay, so what is the occupational therapist? Okay, so have you ever seen when you are going to the mental hospital, there will be the time for the this one patients to do their occupational therapy time. Okay, so there they will be playing, they will do some other works. Okay, they will be engaged with some of the activities. So that we can call it as a occupational therapist. Okay, so this is that all the games or that all the activities controlled by the occupational therapist or activity therapist. There will be the one person will be there. Okay, so here what are the things they will do? The occupational therapists in the mental health team. So they will be accountable for the recreational and occupational and activity programs. Okay, so what is recreational? Okay, recreational means which will give the patient or which will give the people to more happy, and they will be having the playtime. Okay, recreational time. So maybe cricket, whatever, they will be conducting the recreational time. What is occupational? Maybe some other place they will conduct some of the occupational. Okay, so which is related to work. Okay, they can earn money, like the simple task or simple this one work they will give for the patients. And that activity programs, they should be having the active and their body healthness. Okay, they will give the exercise, small exercise, and doing some of the tasks or the work. Okay, so not all the things will be controlled by the occupational therapist or as the activity therapist. Okay, so next one is that he assists the patient to gain his skills that help them cope up with more effectively, to gain and retain the employment, to use the leisure time. So okay, why they are giving like that occupational or the recreational or the activities to the patient? So The patient may have some of the skills. Some are will be good in cricket or some are will be good in football, whatever the task, they have the some of the skills to to regain or to maintain their skills. Okay, regain their skills. So they are giving kind of this occupational recreation to the patient, and which will be help the employees to use their leisure time. Why they are saying that? Whether they are conducting the time in during the this one staff duty time, it's not like that. So they will conducting the patient this employment staffs will be there. No, so here the occupational therapists, their free time they will be using. Free time, that is the leisure time they are using. Free time only they will be conducting these kind of activities. Okay, so that is about the occupational therapist and activity therapist. Then fifth one is a counselor. Okay, so I hope you guys heard about the counselor. They will give the counseling. Okay, so those who are giving the counseling, we can call it as a counselor. So what the counselor will do in the mental health team? So the counselor will do the basic supportive counseling and assist in psycho-educational and recreational activities. Yes. They will give, first of all, they will give the supportive counseling. Okay, those who need the counseling. So whenever you will get depressed or you will get any mentally, not mental illness, okay, somewhat mentally confused, emotional or mentally something affected, you will go and approach the counselor. Okay, yes. So counselor will give the supportive counseling. So they will motivate us. Okay, they will solve, they will give the solution for our problems. So that is a counselor will do, and again they will do one after then assist in the psycho-educational and recreational activities. Some of the activities they will say, okay, so they will say, they will, when we are approaching the counseling counselor, so they will say, what do you like, you do engage with that work, so you can neglect that stress or the tension. Okay, like that they will give, and they will assist in the some of the psycho-educational and recreational activities. Okay, so this is about the counselor. Next one is a psychiatric social worker. Okay, so social worker, you have heard about it. Here the psychiatric social worker means who will give the more concentration to the psychiatric ill patient or the risk families or the groups which is coming under the psychiatric. Okay, so here that psychiatric social worker means what is the function or the responsibility, their role, who should be, can be the psychiatric social worker. So she should be have the masters in the degree of social work. They should be have the master's degree in the social work and PhD in the specialized training in the mental health settings. Should be have the PhD in the mental health settings. Okay, it should be have the training and the this one PhD in the this one. And with he is accountable for the family case groups and community placement of patient. As we know, social workers means they will be more oriented to or they will be more control over the family and the community. So here they are giving only the accountable for the family case workers. Family case, the problem, mental health problems or the community based mental health problems, they are giving the more importance. So that is their functions. And they conduct the group therapy sections. Yes, they will conduct the group therapy section. Here also the psychiatric social worker also will be conduct the group therapy works sections. And he or she emphasizes the intervention with the patient in the social environment in which he will be live. So they will be have the interaction with the patient in the social environment. Yes. Once the patient got the mental illness, again the patient go into the society, how the people will be treat the patient. So there is an interaction problem will be there. Okay, they will say that the patient had mental, so we shouldn't talk to him like that. Lot of things will be there. So all this will be have the interaction, how to live in the society. All this will be taught by the psychiatric social worker. Okay, so they will give the this education to the psychiatric patient, as well as they've given the education the family members and the community society. So how to be treat the person, the patient who recover from the mental illness. All of these will be controlled by the psychiatric social workers. Okay, so in this video we have studied about the mental health team. Okay, so who all are will be coming under the mental health team? A psychiatrist, a psychiatric nurse, and the clinical psychologist, and occupational therapist, counselor, and the psychiatrists, social workers. Okay, so this is about the mental health team, and I hope you guys is understand this video. If you want the notes, I will be given in the description box. You can access the link. If you have any doubts, please put on the comments in the comment section. I will be clarifying your doubts. Please share these videos to your friends. Thank you for listening. Thank you all.